as the word suggests, we have steroids which are the causating factor here. This is also a type of secondary open angle glaucoma. Though most commonly the topical steroids are responsible for steroid-induced glaucoma, but even oral steroids, inhalational steroids, and even skin creams, they can also cause increased intraocular pressure. So when the patient who is using steroid gets increased intraocular pressure, now this condition is called steroid response, or I would say these patients are steroid responders. Now every patient is not a steroid responder. Some patients can be steroid responder. So the patient, sometimes students ask me that, sir, you are using steroids in uveitis, that the steroids can basically cause glaucoma. But remember, every steroid would not cause a glaucoma, and every patient would not have a increased intraocular pressure. Some patients are more at risk for steroid induced glaucoma or a steroid response. So what are these patients? What are the risk factors for steroid induced glaucoma? So these patients who are already a primary open angle glaucoma patient, they are more predisposed to get a steroid response. Patients who are having high myopia, patients who are having blunt trauma to eye, diabetes, pigment dispersion syndrome, last but not the least, who are having a family history of steroid response or primary open angle glaucoma. These patients have more than 10% chances of developing a steroid response. So these are the risk factors for having a steroid response. Also here remember that gene MYOC or tiger gene, if the patient is having mutations in MYOC or not tiger gene, these patients are also having more predisposition to get a steroid response, and this was a previous year question. Okay, now we come to what is the pathogenesis. So pathogenesis is basically it stabilizes the lysozyme enzymes. Okay, so now what is happening because of this stabilization of lysozymal enzymes in the ribosomes? So now the extracellular matrix which is being deposited in the trabecular meshwork, that is not basically cleaned away, and there is increased resistance to the aqueous outflow. So just one point for theoretical purpose, stabilization of lysosomal enzyme, previous MCQ in PGI. Okay, now comes what are the drugs which can cause increased intraocular pressure. So there are some drugs, some type of steroids which have more predisposition to cause increased intraocular pressure as compared to other ones. So these two types, they are called hard steroids and soft steroids. So what are hard steroids? Hard steroids are steroids like prednisolone, betamethasone, dexamethasone, okay, even difluprednol. So these all are having high predisposition to cause increased intraocular pressure. Those steroids which have low predisposition to cause increased intraocular pressure, they are called soft steroids. This was also a previous year question. So remember, they are loteprednol and fluoromethalone. Okay, now what is the treatment? Treatment is very simple. What you do is you just have to stop your oral or topical or any type of steroids, the pressure would automatically come down. And if there is already a damage, you can start with the anti-glaucoma medications. If the patient still is not getting a reversal of the intraocular pressure to the normal side, that means a permanent damage is already there and still the intraocular pressure is high even with the maximum medication, then you can go with the surgeries that we would discuss later. Now, one thing more that I want to basically highlight here is that new intravitreal steroids like Ozurdex, they also have a very high predisposition to cause a steroid response. The problem is now when this drug is inside the vitreous humor, now you cannot do anything, okay, because this would continuously, if the patient is on topical or oral steroids, you can stop it, but intravitreal steroid, if it is there, then it is very difficult to basically remove it. You cannot do a vitrectomy there. So in that cases, there are chances that patient may go into end stage glaucoma. So most of the times in that cases, you require a surgical intervention.